Good afternoon, Peters Township. My name is Tori Billings, and I'll be your host for this episode of The Edge. Acne is a very common skin condition among teens and adults. Maybe you know the struggle of acne. You've tried every wash, scrub, and pill out there. Approximately 85% of people ages 12 to 24 experience acne. Some people have found that changes in their diet or products have led to healthier skin. Today, I am joined with Samantha DeBone, a dermatologist at Sorelli Dermatology in McMurray, Pennsylvania. Thank you so much for coming today. So I wanted to start with just the basics, like what is acne, really?
So acne is actually a dysfunction in the pilosebaceous unit of the skin. Each pore in our skin has this unit. It's made up of the pore itself, the hair shaft, and then your oral producing glands, which are called your sebaceous glands. And when different processes within that unit go awry, it can lead to an acne lesion.
So what causes that, stuff to go all haywire and weird?
So there are 4 different processes that can go wrong. The first is when you have an overactive oil gland. You get excess sebum production. That sebum kind of acts as a food for bacteria that are normal on our skin. But when you have too much food, those acne bacteria tend to overgrow. They then start to invade each follicle, which clogs the pore. Then you kind of get these sticky skin cells that act like a roof over top, and it traps them in there. The more bacteria that accumulate, the more sebum, and then you just get this inflammatory response, which is then your acne lesion, your pimple, your pus bump, or your tender nodule that can form.
Right. So with school and everything, how does stress, obviously that doesn't get dirt and stuff, but how does stress contribute to acne?
So there's a lot of different things that can worsen or exacerbate acne. You know, stress is one thing that we have found to be an exacerbating factor. While the pilosebaceous unit and that dysfunction within it is really the main cause, there are a lot of different things. Hormones, stress, which affect the hormones. So that's where we see stress be a big factor, is more so in acne that is hormonally driven.
How does diet changes and stuff have an impact on your acne, or does that have an impact? Yeah.
You know what, that's a really good question. It's actually a quite debatable question at this point. There have been a few formal studies performed. I think currently in the dermatology community, our general recommendation is there's no great diet change that I can give you and feel very confident that it's going to completely change your acne outcome. Now, I think we're at kind of the point where there's going to be a lot of more studies being done. But at this point, there have been studies here and there. There's one that showed milk, dairy products to be a worsening factor. That same study didn't really show a difference in acne with sugar and chocolate, which a lot of people think will worsen their acne. Greasy pizza, chocolate. You know, I have a lot of patients coming in telling me, this is my trigger, I eat a pizza and my acne flares. I just say, well, that might be your trigger. Maybe you avoid those different triggers. But as far as going in when I'm doing an acne treatment plan, there's no specific food group or recommendation that I make.
Yeah, that's something my mom always says. She's like, oh, if you eat all that chocolate, it's going to make your acne worse. But
common misconception. It's not a dirt problem. It's not a food problem. Generally, it's an issue with that pilosebaceous unit.
Okay. So what about makeup? I know that's especially in teenage girls and stuff in high school.
Right.
And being a dancer, I wear a lot of makeup.
Absolutely.
And I've tried to stop wearing as much makeup, but how does that really can that worsen your acne also?
So another good question, a question that I guess get asked a lot, in clinic. And again, makeup, I would not say it's an overall cause. You have to have that predisposing issue with the unit in the skin. But there are certain makeups that can clog pores or worsen that pore clogging. And so an important thing to look for on any label is going to be the word non-comedogenic. This should be on any makeups that you're wearing, moisturizers that you're using, soaps, cleansers. If you're acne prone, you have to make sure that you're not using, a body wash for your face because it might not be non-comedogenic.
Right.
That is really a key term you should look for on any label if you're acne prone and using cleansers or moisturizers on the face, chest, and back, makeup's included.
Right. So if you are wearing makeup and you don't see that or you may not look for it, how do you feel about primer? Because I know a lot of things are pore minimizing primers.
Sure.
Do you think those are actually effective when you put makeup over
Tough
it?
question, but to be honest, any primer should also have non-comedogenic. I think a lot of companies are aware enough that patients are going to be looking for that label, that anything that is going to be going on the skin, either before makeup, after makeup, should have that label on there, non-comedogenic or non-pore clogging.
Right. So with all these different kinds of things that impact acne, what about weather? Is it true that like the weather or like the location has an impact on your skin too, or?
Another question that's probably debatable, I think the weather as well as other things like diet are going to be very patient-based. I think one thing about warmer weather, which also can go into more athletic patients who are sweating, you know, we do find that sweating and the friction and rubbing of certain athletic gear can worsen acne. And I think the one way that the weather might tie in there is warmer weather, increased sweating, and then you get excess of the sebum production of the skin.
And does washing your face, like I know when I go to Florida and the weather's all humid and hot, it's like I feel gross, you know. So is it like, how many times a day should you wash your face? Like especially if you're somebody that's really active, or like how many times do you think that?
Generally maximum 2 times a day. A lot of patients who are acne prone think that if they, you know, wash the face 10 times a day, they're going to clear all the bacteria. It's really not true. There's a slippery slope when you get to washing the face too much. If you overly aggravate the skin of the face, overly dry it out, our skin likes to be oily. Especially skin that's acne prone. So you might find that your skin starts to overproduce those oils, which can then worsen acne. So my recommendation is once or twice a day, gentle cleanser or a cleanser that we have recommended for the patient, and avoid anything that's going to be overly irritating to the skin. Be careful with exfoliating, different types of cleanses and washes as well.
What about like makeup wipes?
Makeup wipes, I do like makeup wipes. I think that they're great to remove makeup before you maybe use a medicated wash, and also great for athletes or patients who are going to be working out who can't shower immediately and get all kind of the sweat off of their skin. A makeup wipe or a gentle wipe just to remove those excess oils after is helpful.
Nice. So how many people do you think you see like a day or a month that come in for acne?
That's a good question too. I think it depends on which clinic you're in. It depends on the days in clinic. Certain days I see a lot of acne patients, other days I really don't see so much. I would say probably 20% of our patient population is acne.
Are most of those teens or are they adults? Or like is it a healthy mix of both?
Most are teens. I would say between the ages of 12 to 18. However, you would be surprised how many patients do have what we call adult onset acne. You know, a lot of people think that acne is just a teenage problem. It's not true. We have seen many young adults, women usually in their later 20s who are never struggled with acne in their teenage years, and they have now, you know, are coming in to have their acne treated.
This is kind of a weird question. How do girls and boys take their acne like different? Like when they come in and see you, how does a girl react to it? Because I know girls open up a lot more. At least I opened up a lot to you when I first started talking about it. Is there a difference there? Like, do the guys like, do they like hide it a little bit more than the girls, or do the girls be like, okay, I want it done, I want it taken care of right now? Like, is there a difference?
There is a difference. I think that girls come in, again, more open. I don't have to pry as much. Guys, I do. A lot of the younger guys, you know, they say it doesn't bother them, but you can kind of tell. More so in the later visits when the acne is starting to look better, their confidence level increases, they're more open, they're smiling. So I think it can have a huge impact on the patients, but girls initially are generally more driven. They're more prone to put on medications and be compliant with treatment plans. It's just harder for guys. I think, you know, girls are just used to taking care of their skin at a younger age. So it takes a little bit more education. Making a plan that's right for the patient is important. You know, sometimes asking a patient, being honest with me, how compliant do you think you'll be? And that way I can make a plan that will benefit them, regardless of guy, girl, and that kind of thing.
Going with like the plan and everything, how do kids, like when you say you want to put them on, not really an aggressive, but like when you want to start them on a medicine or a certain topical or something, how do like kids react to it? Like are some kids more open to it than others?
I think it depends on the patient and how motivated they are. As clinicians, we really have a stepwise process that we go to figuring out what's the best treatment plan. The way that I personally like to do it is, one, getting a feel for how much it bothers my patient. Is this something that they look in the mirror every day and they really have self-confidence problems on? Then I think I need to be a little bit more aggressive. You know, if it's someone who it doesn't really bother them, they're not super motivated, then maybe we'll do a more, you know, an easier plan. But it just depends on the patient. The type of acne is very important as well. You have to look at the type of acne. There are different medications, both topically and orally, that work differently. And so you can't just throw the same acne treatment plan at every single patient who has differing types of acne.
Yeah.
So it's very specific to the patient. A lot of the times each follow-up, it takes small changes within each plan, and everybody's different.
Yeah.
But I always like to be very open with my patients and give them all options available. Where I work, we always want to help people.
Yeah.
We don't want to say this is how we do acne, and if you don't like it, you can go elsewhere. We always try to find a way that one is going to be beneficial, and two, that they feel comfortable and happy with.
I know. Whenever I went, it was really nice to have somebody like you who was very you really did care about what I wanted to do with my skin, and I really appreciated that.
Absolutely.
So, kind of for the people who don't go to a dermatologist or how do you feel about those things you see on the internet of at home DIY acne remedies, like putting ice on your skin or something? Is that effective, or is that not really that's just? I'm curious.
Yeah, I think it's again a question I get asked a lot. A lot of patients are interested in the natural remedies. They want kind of an overnight treatment.
Yeah.
And to be honest, there's really not any overnight treatment. And with a whole lot of these remedies that you get at home, there's no clinical evidence to support them. So while we might know that, say, tea tree oil has anti-inflammatory properties, has it been formally studied in dermatology? No, not yet. So as far as what I do in my office, it might not help the acne, but it might not hurt it. And so I try to give them that, that type of information. I don't think it's going to hurt. If I think it might hurt, it might be a pore clogging, thing. I tell them to stop, but I just try to give them, again, input that I feel is appropriate and has been studied.
Yeah.
And then answer questions accordingly with what they might have with the at-home remedies, because there's a lot that you'll read online.
Yeah,
not all of it's true.
Yeah, before I started going to the dermatologist, I was one of those kids that would search it on the internet, because I was one of those kids. I would look in the mirror and I'd be like, well, this sucks. I wouldn't want to go to school. I wouldn't want to go out and hang with my boyfriend or anything.
Right.
And it's sad, So I was one of those kids that would look up how can I get rid of this pimple overnight? And I'd have my mom buy all these crazy ingredients and try and put them on my face.
Try everything. It happens. You're not the only patient.
So we're going to take a quick break, and when we come back, we're going to discuss oral medications and Accutane. Welcome back to The Edge. So, what medicines or topicals or products are available for people with acne?
So there are a lot. Over the counter, which you can buy at any drugstore, there's generally 3 different ones that are available. One is salicylic acid. You'll find this in cleansers and topical therapies, creams, ointments, and gels. Benzoyl peroxide, which again you'll find in different cleanses and gels. And then the other one is adapalene, which is newer. It's actually a type of retinoid topically that you can buy in stores called Differin. So
what is the major difference between a topical and an oral medicine? Obviously one's a pill, one's more of a cream or a gel. What's in them though? That's
in the products?
Yeah.
So with the over-the-counter ingredients, those 3 are generally, the FDA said, these are safe enough that they do not have to be prescribed by a professional. The other ones that you'll find topically, as far as prescription topicals, you have your antimicrobials, which are going to be things like clindamycin, erythromycin, dapsone. Then you move into your topical retinoids, which are going to have your adapalene, which there's other varying degrees that can be prescribed as far as potencies, your tretinoins or retin-A's, and then your tazarotines. And each of these are different types of topicals that have different things that they treat in that acne process that we were talking about earlier, the clogged pores, the bacterial overgrowth. A combination of these medications can work on each separate process. Now, based on the severity of the acne, is this mild, is this moderate, is this very severe? More in your moderate to severe cases, sometimes to control that inflammation, you need something orally. There are certain antibiotics available that are very good and have very good anti-inflammatory purposes. A lot of the times we know that bacteria are involved with acne, and we think that these antibiotics are used for bacterial purposes, but really it's for the inflammation involved. And so the group that we use most often for acne, is the tetracycline family, so your doxycycline and minocycline, and those act a lot on the inflammation actually starting at the pore. So the combination, rarely will you ever see a dermatologist or a PA or NP in dermatology just give one treatment for acne unless it's isotretinoin or Accutane.
Right. So do you think Accutane truly is the most effective? Because I feel like that's the one that most people go on, or at least.
Yeah.
So how is that? What is in that one specifically out of everything that gets rid of the acne?
Yeah, so I think Accutane has a reputation, and isotretinoin is the name for it, of being this very strong medication. But a lot of people don't know that there's actually a naturally occurring amount of isotretinoin or 13-cis retinoic acid in our systems. It's a form of vitamin A. And so when we treat acne, we give it to you synthetically with a pill, but at higher doses. Those higher doses are actually able to treat all the different things that go wrong in that pilosebaceous unit in acne. Controls the sebum production. It helps the pores stay clear, and all of those different things. So when you give isotretinoin, I think because it is available to do all of those different things, yes, in and of itself, it's probably the most effective medication. But you have to look again at the severity and choose the correct patient to go on the medication.
What are the qualifications for somebody to start Accutane? Because I know it's not something that you can just give out. Because I know my period before I got it was a long time. Right. Like months.
Yeah. So there are generally guidelines that we follow as providers, and I think most of us will look at, rarely do we just jump right to Accutane. The acne has to be pretty significant and severe. One important thing that we look at is scarring. If there's evidence of scarring, just because, again, usually these patients are younger, a scar is for life. We want to prevent that as much as possible. So I would say the one reason to go right to it would be scarring. And if you have a really, really severe type of acne called acne conglobata, which is a mixture of all of the different forms of acne, you get your papules, your pustules, your nodules, really tender cysts, and comedones all in one. That would be another reason too. Otherwise, you go through your traditional therapies, which generally include a combination of topicals with an oral anti-inflammatory like oral minocycline or doxycycline. 3 to 6 months of that regimen, we should get patients clear to mostly clear. If they're not, it's always reasonable to consider it at that point, because there are risks to doing long-term antibiotics that we have to consider as well. And so instead of patients being on these oral medications for years and maybe not getting the results that they want, we now have Accutane or isotretinoin as a wonderful option for those patients.
So just a side question, and I've actually been meaning to ask you this. Accutane does clear up acne scars, but does it clear up like other scars? Because I have a few scars like right there, and I was wondering if my Accutane was going to fix that.
Generally not. Yeah. So the Accutane, what it does, and I think it can be misconceiving, a lot of us think of scars as the dark marks on the skin that acne causes, but it doesn't. That's just called post-inflammatory hyperpigmentation. Think of it as the skin working out the inflammation from that acne lesion. A true acne scar can look like a divot in the skin. We call that atrophy, or almost like it looks like you poked a needle in the skin. We call those ice pick scars. So Accutane cannot cure those, but what it does is it clears the acne that can cause those, but it really helps the skin with the cell turnover rate, so all of those dark marks do tend to resolve more quickly when you're on Accutane.
So when I was on the doxycycline, and I'm sure a few other people, and the first few months of Accutane, why does the medicine make it worse? Like, I know it's coming all out, like it's getting everything out, but why does it like do that so intensely all of a sudden?
It's a good question. So anytime there's processes within the skin, it takes time. It's not something that happens overnight, and everybody's a bit different. Some Accutane patients will clear up right away. Within the first month they come in smiling and really happy. It's like, my acne's clearing already. It depends on the type that you have. It depends on what's going on deeper in the skin, whether you're going to be that patient that clears right off the bat, or whether you're going to be that patient that deals with flaring, up and down for about 1 to 4 months.
Right. So what are the different side effects with acne or Accutane, and how do you how do patients come in and react to them, and are there things that you will give them that'll help their side effects and stuff?
Absolutely. So with isotretinoin in particular, I think that's the medication that you read a lot of stuff about online. And the stuff can be bad or good. A lot of patients have had wonderful results and want to share those results. But then, there's other things that you read about it that sound really scary. It's important to know that we're doing a whole lot of studies on this medication, and the more we do, we find that it's just an exceedingly safe medication to take if you monitor it appropriately. And so I look at isotretinoin as more of a commitment. We do want to see every month.
Right.
There are certain guidelines that women in particular need to follow due to the pregnancy status of the medication. It is an X. There's a FDA regulated program called iPledge that you do have to be registered in order to do it. And so there are hoops to jump through, as we say, and it's a commitment. So seeing us, doing the appropriate lab work, and follow up. But it is a safe medication, and that's important. Within the last couple of weeks, actually, there have been more studies published showing that it is so safe, the lab monitoring might change, meaning that we might be doing too much as providers because it is so safe. We're seeing that patients are tolerating it very well.
So why do people on Accutane have to get their labs? Obviously, like the pregnancy stuff.
Sure.
But why else what do those labs present? Like, what information do they give you guys?
So isotretinoin is produced, the naturally occurring amount, that 13-cis-retinoic acid, is produced by our liver. So the medication isotretinoin is also metabolized through the liver. We want to make sure that we are not overloading the liver. On a day-to-day basis, you are taking in different things like ibuprofen potentially, different foods. Everything can be metabolized through the liver. So we just want to make sure that we're not overloading the liver.
Right.
Another way that the medication is metabolized, it can increase your triglycerides, which is a type of cholesterol. So we want to make sure that those don't get too high and cause a pancreatitis. So those are the main ones, and then of course the pregnancy.
So with the pregnancy, obviously if you get pregnant on Accutane, that's not going to be good. But what about in the long run? Is that going to have any effect on pregnancy in the long run?
None whatsoever. As soon as the medication is not active in your system, there are no risk of birth defects due to being on Accutane.
That's good. So what, how do different doses of the medicine, can that increase your side effects? Like, can somebody start with 20 milligrams, right? 20 milligrams and then not have a lot of side effects, and then maybe get bumped up to 30, and then their side effects can start? Is that common?
So what I see mostly is most of the side effects occur within that first month. I'm going to really kind of get a good idea how my patient's going to tolerate the medication within that first month. Small dose changes can help. Say they're having a large side effect profile with a lot of dryness. I will decrease the dose. Most people do wonderful. Same with a little bit of joint pain that you can get. You can decrease the dose. If a patient has more of the severe acne, to decrease the chance of a flare, I'll start low and then increase. And slowly increase as they tolerate it better. So it really is patient dependent. This is always a medication that I talk to my patients, be open and honest with me. I can get you through.
Yeah.
And I can make changes as I need to, as long as you're letting me know how you're feeling.
Has there ever been an instant, now you don't have to say names or anything, where Accutane was just so rough on somebody that they had to stop? What happens then if that?
So I've had patients take breaks. Mostly because they were going through things in their own personal lives that maybe were a little bit more than the normal person, and Accutane was just an additional stressor.
Right.
So I don't think I would say I wouldn't have ever had to stop because of a side effect just because of isotretinoin, but I have taken breaks in therapy and restarted.
And that's okay. Is it okay to take breaks?
It's okay to do, absolutely. You don't have to wean off this medication. You can stop cold turkey without any side effects.
Okay. So can you go on Accutane more than once?
You can,
Is
absolutely.
Do you have to wait a certain amount of period before then, or can you just finish it and then go on it another month later? Or
generally I would like patients to take at least a 6-month holiday from it, and usually we don't stop the medication unless the patient is clear at the end of therapy. So but say we take a month or two break on a patient that hasn't completed their course, you can start right back up. So there's no specific timeline that says you have to wait this long.
Right.
Especially if you completed therapy. I will say I've never had to start somebody within those 6 months after completing a solid course of the medication.
What is the longest amount of time somebody can be on Accutane?
So that's a really good question. Accutane is used for actually now a lot of different reasons than just acne, believe it or not. And so there are certain instances where longer courses might be needed, but you still have to abide by those guidelines.
Right.
So I'd say personal experience, acne, about a year is what I've had somebody on before, more on the severe end.
So does the dosage, if it's higher, does that mean you have to be on it for longer, or if you go on a higher dosage, does that mean you can decrease the amount of months you're on it, or is the dosage strictly just how the type of acne?
Good question. Different providers do it different ways, but I think there is a target dose that you want to reach. It's 120 to 120 milligrams per kilograms, which is the patient's weight. So you do this calculation at the beginning, and then you kind of separate out and look at the day-to-day dose. We try to get patients through their course within a minimum of 5 months to a maximum of 10 months, and so we dose that month-to-month medication accordingly.
Right. Can acne come back after somebody finishes Accutane?
The goal is not. The goal is to put this into a permanent remissive state. It is the closest thing we have to a cure for acne, although there is no cure for acne.
Right.
But the goal of this medication is one time and then you're done for life. But, yes, there have been instances where the acne comes back. Some acne is just very recalcitrant and severe. And so we always have this to do as a next option.
And what are some ways after somebody finishes, like what are some face washes or anything that you would suggest to prevent that acne from coming back again? Or is there really no way to prevent it again?
So a good maintenance therapy, we call it, to start after anything, like any acne treatment plan. If you're clear, is a nighttime retinoid, which is going to be your epiduos, adapalines, retinases, tazarotines. That they can kind of work at that pore level to keep the skin clear. So it's a nice maintenance to have on board.
All right. I hope this segment has helped you learn about acne and the importance of skincare. Keeping your skin healthy is crucial because your skin is the largest barrier against skin infection that we have. Maintaining a clean face helps this barrier remain strong. While many benefits can be made at home simply by taking care of your skin, dermatologists are always available to help if you aren't sure about the proper way to keep a clear complexion. Thank you so much for joining me, and until next time, PT.